Good morning, good afternoon, good evening, depending on what time you're watching this. Welcome to another edition of Rock Hill Video. I'm your host, Chris Corrado. As always, I do the best I can when I bring my guests on to inform you. We're not here to bash anyone, we're not here to praise anyone. This is an equal opportunity forum for our guests to talk about themselves and how they can be a resource for you. So today, I have brought on Dr. Vennus Ballen. She is a former classmate of mine from back in the day, and I had asked her to come on to talk a little bit about herself, her practice, and learn more about how we can adjust to these times we're in when it comes to COVID-19. So Vennus, thank you for coming on our show. Dr. Ballen, thank you.
Thank you, Chris. I'm happy to be on the show with you.
This is great. So this is the first question I had. I wanted to just learn a little bit more and have our viewers learn a little bit more about just your early life background that you wanted to share with us.
Sure. As you had already alluded to, we went to school together. We grew up together back in Queens, New York, and born and raised. I completed college at New York University. I did my medical school training at Mount Sinai School of Medicine in New York. And I did my first of two residencies. I did most of my training in New York, but one of them was in general pediatrics at Long Island Jewish Hospital. I completed 1 year of a pediatric oncology fellowship in Cincinnati, Ohio. After that, I took a couple of years off of training more to kind of refocus myself and try to recalibrate what my passion was in medicine. So I spent a couple of years doing general pediatrics in Louisiana, in New Orleans. And then I moved back to New York. And around 2014, I completed a second residency in public health and preventive medicine at the New York City Department of Health. And that's where I completed my master's of public health. I finished that at Columbia University. So leading up to today, I do kind of like a hodgepodge of things now. A lot of consulting, doing general pediatrics, and a lot of broad public health work, working in sexual health, so like STIs, HIV care, and most recently now COVID. So I do some day-to-day COVID work now in addition to some of the clinical work that I'm still able to do on the side.
Great, thank you, Vennus. So I did want to point out that when I asked my former classmate to join, we definitely gonna ask some really great questions. I knew she'd have integrity when it comes to answering them, but I'm not sure what she's gonna say, but I feel very confident in the answers she's gonna give us are very helpful. So once again, I didn't bring her on here there's no bashing, no praising. This is just an equal opportunity for her now to answer some questions and tell us more about her practice. Vennus, is there anything else you wanted to add? I know we started talking about your work a little bit. You're in New York, and you spent some time in Cincinnati and down in New Orleans. Anything else you wanted to share about the medicine you practice or a typical work day for you?
Sure. Typically, so I used to do more clinical work up until a few months ago when COVID started. So typically my day would be from 9 to 5, doing clinical work. Basically, I was working mostly in an STI clinic or in a sexual health clinic, so providing a lot of day-to-day services for HIV and syphilis and gonorrhea and stuff like that. So I would treat people pretty much anywhere from the age of 12 up to, elderly, pretty much. And it was, I certainly miss it, Nowadays, since I'm doing more kind of work from home, a lot more administrative, a lot more policy-based work. So I'm trying to maintain 9 to 5 hours, but trying to balance that with childcare could sometimes be a little tricky. So I put in 7 hours a day somehow. That's basically where I am right now.
Okay, thank you, thank you. And now a word from our sponsors.
Oh, the miles we've walked, you and me, and the memories we've made, friend. So many stories, but I know you'll never tell. The crazy ones we need to forget, to rock bottom that made us our best yet. From milestones and firsts, you've been there, from me to we to us. Thanks for all your love, from beginning to end, friend.
All right, welcome back. So now I definitely want to learn a little bit more. I mean, there's in your job career, it's probably very rewarding, and you love doing it. Obviously, I could see you have a passion for it. So, you know, even sometimes I always say, even dream jobs have nightmares. So I definitely wanted to learn more about some of your favorite memories, and I also wanted to talk about some of your biggest challenges.
Sure. I'll say that my most rewarding moments or my favorite memories in my career have definitely been when working with patients and seeing it's more than just the gratitude that I was able to treat them and I gave them the right diagnosis. It's more than that. It's more that we were able to cultivate an actual relationship. You know, I work with them over the course of a few months, you know, because we don't do too much continuity of care in the clinic where I work, but the patients with which I do provide that continuity of care, really, the patients are just so relieved and so happy to feel that they feel like they have someone on their corner, you know, and when they actually thank me, or when they listen to me and they see that I'm not out to get them. I'm listening to them. I'm listening to their concerns, and I'm trying to give them the best advice possible. And to see them actually follow it, and then to have them say, you know what, you were right, or you know what, it worked. I am so grateful. That's really, honestly, one of the most rewarding things that I experience day to day. In terms of challenges, I think that like many jobs, you know, there's a bureaucracy, and you have to deal with expectations that are outside of the direct scope of practice which I was trained to work in. So that's a very polite and diplomatic way of saying having to deal with a lot of red tape and having to deal with upper management with things like you know, what their expectations are versus what the reality is in clinical practice, and then trying to come to some sort of a middle ground, you know. Those are the main challenges that I've had with work. With patients, sometimes I will encounter a patient who just doesn't, you know, I give them the best advice possible. take the medicine they need to take so that they can stay healthy. In particular with patients who have HIV and they need to take medicines every single day, and they don't listen for a variety of reasons, very complicated reasons. And those patients can be very frustrating, and it's I know that it's not a reflection on me personally all the time, because they come, like everybody, they come in with some sort of baggage, and after years of having a condition, or being years of having difficulties coping for whatever reason, they came to a decision that they don't want to comply, and that's very difficult to have to deal with. And I just, unfortunately, sometimes you just have to kind of take it in, take some breaths, take a few minutes, and then you have to move past it because you have to move on to the next patient. And I have to be able to give my all to that next one after having tried really hard and not having any result with the last one.
Gotcha. Yeah, I mean, you definitely have professional advice you share with people. At the end of the day, though, I'm guessing it definitely can be a big challenge if they're not willing to take the advice and follow through.
Yeah, but that's the nature of what we do as doctors. We give the best advice possible, based on the best available information and medical research that's out there, and we can only go so far to convince people to do what's best for their health, for their individual health. So it comes with the territory.
Right.
You learn to temper expectations the longer you're in it. And I've been at it for 12 years now. So.
Wow. Okay. Long time.
Yeah.
So now we're gonna focus more on what's going on. So we're definitely gonna talk about COVID-19. Before we go on, what is, because some people, they say it all the time, COVID-19, coronavirus. What is COVID-19?
Okay, so I'm going to bring up two different terms, and they're related. Okay, so there's another buzzword that also comes up with COVID-19, and it's SARS-CoV-2. That is the acronym for the actual virus. That's the name of the actual bug, the actual virus that infects the body. Okay. Now, COVID-19 is technically the name of the infection. So, if you get inoculated with the SARS-CoV-2 virus, and however it manifests, the fever, the cough, the chills, the loss of smell or taste or what have you, that is considered COVID-19. Now, for day-to-day purposes, honestly, COVID-19 and SARS-CoV-2, you kind of consider them one and the same in day-to-day talk. But there's like that in the medical world and in the public health world, that's how you distinguish the two. Okay.
Thank you. So, after everything you've experienced, where would you rank COVID-19 as far as, okay, this is the worst thing I've ever seen, or this isn't that big of a deal, or somewhere in the middle?
So, for me personally, this is the worst thing I've seen.
Okay.
I was a resident, a pediatrics resident during H1N1 flu, the flu pandemic, what other people may remember as swine flu. My high school was actually the first place in the States that had it in Queens. And I remember in those days we had flu tents, and basically it was a rally and a surge of all of the staff in the hospital having to administer flu tests and do the flu questionnaires. Now the degree of how H1N1 affected the global population is nowhere near what COVID-19, nowhere near the range of COVID-19. This is just, I mean, really, the only thing you can really compare it to, I'm sure as everyone has heard in the media, is the Spanish flu pandemic during and after World War I, in terms of how widespread this infection has become. I have never seen shelter in place before, shelter in place or social distancing or widespread use of masks before. This is not, this is nothing that I've ever lived through. The ICUs and hospital ERs being over capacity and having to open up surge hospitals in convention centers and other outdoor facilities, I've never seen that before. This is something that is in our lifetime is quite unique. And it really has, it's, and rightly so, it's being taken very seriously by the press and by the medical professionals.
Technicians you can trust.
Quality you can count on.
I guarantee it.
Thank you. So next thing I want to talk about the masks. I mean, this is I can't go online, I can't go on TV without hearing about masks, or we're out in public and some people are wearing them, some people aren't. I have to say, where I am, most people are wearing them, but there's a huge debate. It's going to work, they don't work, it's not healthy to wear it for X amount of time. So what can you tell us about wearing a mask, whether it be something a surgeon wears or someone wearing a bandana? What are some of the things you're hearing that are true and are not true based upon what you know?
Sure. So there are different grades or different types of masks that exist. Now, the surgical masks and the N95s are a specific example of masks that really need to be restricted to the medical setting, mostly because there is a shortage. There continues to be a shortage. And without those materials, hospital personnel are at extremely high risk of getting infected with COVID-19 as well, because of for a variety of reasons. They have very close contact with patients. They have to perform procedures on patients that require being within 6 feet of somebody, and those really need to be restricted to them. Now, the masks that are recommended for day-to-day use, there are a variety. I mean, there are plenty out on the market that I already see, that I utilize myself, whether it's a cloth mask, or a non-medical grade mask that are disposable, others that don't have that valve, those you shouldn't be using anyway. I'll explain why in a minute. But basically, what the whole purpose of these masks, whether it's a cloth mask or a disposable mask, is you're protecting the other person. So about 20 to 30% of people have COVID and they have no idea.
20 to 30.
Yeah, it kind of hovers between 20 and 30 depending on which article you're reading in the medical literature. But basically, that is something that's called that leads to something that's called asymptomatic spread. So basically, the virus particles they live in little droplets and in little respiratory air and aerosolized droplets that come from your mouth and come from your nose, whether from talking, sneezing, just any type of interaction. Right now, I'm releasing aerosolized droplets, and that can get into somebody's airway. That can get into somebody's nose or to somebody's mouth. So the whole purpose of the mask is so that in the event that you have COVID-19, the virus that causes COVID-19, and you don't know it yet, whether because you haven't developed symptoms yet, or you have a little tickle in your throat that you think is allergies because it's allergy season, or because you don't have any symptoms but you could still spread it, you're protecting the other person. Now, that requires obviously a degree of having, I guess like you have to have a village mentality when it comes to protecting others and yourself from COVID-19. That's the best way to stop the spread. The masks with the valves, what I've read about those is that it allows particles to come out, but not to come in. But that's counterintuitive because the purpose of the mask is to protect someone else from you. So you're exhaling from these valved masks, and that air is being released from the valve.
Okay.
There are a few exceptions to wearing a mask, and they're typically reserved for the proper word is you don't need to wear a mask if you have a chronic medical condition. A chronic medical condition in the sense that you would not be able to remove the mask. Neurological issues like diseases or conditions that make it very difficult for you to take very deep breaths. I'm talking like restrictive lung diseases, neurological diseases that make you unable to take off the mask, or if you are an infant or a toddler under the age of 2, because they don't have the capacity to take off the masks in a consistent manner. People do not become hypoxic, or their oxygen levels don't get lower wearing masks. I've tried it myself. I've had a lot of friends who posted videos. Some of my friends who work in ICUs, they posted videos with themselves wearing various degrees of multiple masks on their faces, and they don't become they don't lose oxygen. Medical professionals wear masks 10, 12, 15 hours a day, and they don't get sick from wearing masks, from the inhale, from like wearing the mask and losing oxygen. That's not how the mask is meant to operate. That's not how it operates.
Okay. Is there anything else you could share about, because I know masks are like the main thing people are talking about. What other preventative measures can we take to to slow this down and defeat it?
So there are three main tenets of protecting yourself from COVID-19. One is wearing a mask when you are within 6 feet of other people, or when you are indoors in public places. The others are social distancing and washing your hands consistently. By social distancing, I mean maintaining a space of at least 6 feet from a person. The reason for that is that the current theories about how transmission for COVID-19 works is that the particles, the aerosolized particles or the droplets, they can extend about up to 6 feet. So that's where that number came from. So that's one of the keys. Social distancing also means there's also a time frame. So, with being within 10 minutes, being in an enclosed area, let's say for more than 10 minutes. I'm thinking of a grocery store or a deli or a Starbucks. You're inside for more than 10 minutes. That's an exposure, especially if you are surrounded by people, and some of those people are not wearing masks. So social distancing means staying in an enclosed space for as little amount of time as possible, and wearing a mask. Washing your hands, that's good diligence no matter what. It prevents other infections from being transmitted, but particularly for COVID, what the thought is that COVID can survive surfaces. The amount of time really varies from surface to surface, and it is not the main way it spreads. All right, so I just want to make that very clear. It's not that it's the main way that it spreads, but it's a potential way that it can spread, and it can last for, from like 2 to 3 hours to up to 48 hours. So with that in mind, if you are in a busy location, and if you're on a bus, for example, or if you're at the supermarket or at a Walmart or at a Target and you're touching multiple things from the shopping cart to grabbing different items that other people may have touched before, it's prudent to then, at the end of that, avoid touching your face. And then at the end of that, when you're back in your car, using hand sanitizer, for example.
Okay.
And then when you're home, washing your hands for a full 20 seconds with soap and water.
Okay. So we've talked about COVID-19 and things we could do in the short term. I definitely wanted to look at what we could do in the long term. And what I mean by that is I know somebody who got COVID-19 and he already had some health issues. And actually, when he was diagnosed with COVID-19, he learned that he had even more health issues. So what is your opinion on what we can do in the long term as far as, exercise and just eating right?
Well, I think that's just good general preventive practice, right? So, eating well, fruits and vegetables, minimizing high sugars, high fats, making sure that you eat whole foods as opposed to processed foods. That does wonders for controlling things like blood pressure and blood sugar, diabetes and hypertension or having high blood pressure are two known conditions that can actually make a COVID-19 infection worse. Exercise just in general is very important, not just for physical health, for let's say maintaining your weight or just for weight loss, but also because we've been upwards now of since March, so we're almost 5 months into this, and we're in various states of closure and not being able to see families, that takes a toll on your mental health. And, exercise does raise endorphins. It does make you feel good, and that's important too. Self-care is important, especially during these times, because things are very uncertain at the moment, and you need to find outlets for that anxiety and for any feelings of sadness that one may feel. And exercise is one of the ways that you can combat that, or at least kind of temporarily keep it at bay. But that being said, there are conditions that are, unfortunately, there are hundreds of thousands or millions of Americans who have chronic medical conditions that are difficult to control, regardless of diet, regardless of exercise. And, for those people, that I'm thinking people who have medical conditions like diabetes that can be difficult to control, high blood pressure that's difficult to control, obesity, being overweight, that is not something that goes away very easily. That takes a lot of effort and time. And those are some main conditions that we have found over the course of the past few months leads to more serious COVID infections. For those people, I really strongly advise, to abide by the guidelines that have been set forth by health departments, by the CDC, and by the World Health Organization. Out, otherwise social distancing and washing your hands.
Okay. So I'm not necessarily asking you to take a side. I'm definitely not doing that. But I was curious what your opinion is on why this is being this has become such a political issue. Why would you think that is?
Oh goodness, that's such a loaded question. I'm going to take the more philosophical approach to this. And I'm going to say that I think that we are a country. Let's go back to like the roots of how our country was founded. We were founded on one of the concepts, on the concept of liberty. And with that in mind, and the pursuit of happiness. And I think that people are taking these mandates that are, as of right now, being instituted mostly at a state and local level, and they're taking that as an infringement of their right to liberty, because that is how we are that's what's ingrained in us, having been raised in this country. I think that transcends the more political. I think that it transcends politics in that respect, because what I hear is, and most of my friends do think it's appropriate that these mandates exist, but I have spoken with people who feel that that mask wearing infringes on their own individual right to freedom. And I think that's what's at the core of what these of why it's being politicized in this manner. If you look at other countries where this is not like it's not as much of a founding basis of their country, or their democracy, or however it functions in their country, the compliance rates, the adherence rate are so much higher. And why is that? It has to deal with more than just politics in that sense. I feel that it has to do with the fact that there's a different sense of what is of what is expected from them as a citizen. You know, my personal feeling, and I don't know if I'm afraid to say it, but I am of the opinion that wearing a mask and abiding by social distancing is, in these times, is a way to maximize the freedoms that we have. I'm thinking of it in the opposite approach. If more people wear masks and more people abide by social distancing, then the rates of COVID-19 go down, which means then that more things can open, which means that we can now enjoy more things. But in order to be able to enjoy those moments, those events, going to eat at a restaurant, going to a movie, anything, you know, then wear a mask. Because then you can enjoy it. You can go and enjoy that. You can enjoy that. You know, I think that that is my opinion. You know, I also feel that, you know, at some point we have to not just think of our own individual selves, but we have to think of ourselves as a community of people. You know, my actions do not solely affect me. They affect my family. They affect my next door neighbors. They affect my coworkers. You know, I don't live in a bubble. None of us live in a bubble. So I feel that if we were to think of what's going on as not just what's happening to us individually, but what's happening to us as a community and what we can do as a community to get ourselves out of this mess, then wearing a mask and abiding by social distancing is the answer.
Okay, well that pretty much answered what I was going to talk about next, was the common ground on how we could work together. Anything else you want to add on how we could work together and find common ground on this?
Man, I stole my own thunder. I mean, really, I feel that we have to try to think of what's going on with this pandemic as something that's going on. I think that we have to look at it as something that's affecting everybody, and not just what's going on in the news in some other state somewhere, because I know that was the case in March and in April when it was here affecting New York, or as, you know, as it being an infringement of rights. You know, in a sense, COVID is not discriminating against who it attacks. You know, COVID has affected everybody in some respect, whether someone got sick, whether a family member has died or became incapacitated from COVID, or someone had lost their job or was furloughed or what have you, or, you know, their kids aren't in school anymore. You know, everyone has been affected in one way or another. You know, so if everyone can do their part, and what that means really is just wearing a covering, a face covering, go out, and to keep going out at a minimum and keeping it as, you know, as minimal as possible, or staying away from crowded and closed spaces as much as possible. That's the best we can do for our country right now. That's kind of the most patriotic thing one can do for this country with respect to the pandemic.
Great, thank you, Venus. So, one of the last things I wanted to talk about is two doctors we definitely hear about in the news a lot is Dr. Fauci. I know he's been on, I've seen him on multiple stations. Then there's Dr. Gupta. I typically just see him on CNN though. A lot of people, you know, are like, hey, these are the guys you got to listen to. But then, of course, there are some people like, oh, you don't want to listen to them. They've been bought out by the government or the stations to say what they're saying. And so I was just curious, what do you think about them and how they're doing right now?
So they disseminate information very differently. personally, I listen more to Dr. Fauci. I think what he says is very clear. I will say this. Sometimes I think what he says is not very easily, I think sometimes, I mean, I understand because I'm a medical professional. I don't know if other people who don't have my background may necessarily understand, because I feel that he does speak at such at a very intellectual level, and I think he tries his best to distill the information in a way that's like easily digestible, but I don't think he's always very successful.
Okay.
That being said, I think he's very good at what he does as a whole. With Gupta, I've only seen a few of his snippets, to be honest, but what I like about his approach is that it's really digestible. And I think that it's information that I think that it can be very easily understood by most people, regardless of their educational background. And I think that it's very clear in that respect. I mean, some of the stuff that he says is, it can be a bit vague. And I think sometimes that can lead to more questions than answers. But that being said, I think that what the information that he says is, I think that the information he gives is done in a way that makes it palatable for most people, like for the audience that CNN has. I mean, be that as it may, I don't think I'm the only public health person to have said this, but I will say that as a whole, the messaging since the beginning of this pandemic has been, not good. It is very confusing, and for me, as someone who I trained in this and I work in this, and it's like whiplash. It's like mental whiplash when they go from one recommendation to another. I can only imagine how someone who is just trying to understand the basic concepts of what's going on, someone who doesn't have a public health or a medical background or science background, I can completely understand why people are so skeptical, because the messaging has not been very good from the beginning. And now it's like the public health and the medical professionals are trying to play catch up and trying to have people believe them, but in the beginning the messaging was so inconsistent that, it's like, who do you believe? You say things one day and then they change their minds the next day. There's a reason why, but to the general public, that it doesn't look that way. It looks like you're making stuff up. And it looks like it's just like coming out of nowhere. And I understand that completely.
Great.
I sympathize with that.
Great, thank you. In closing, I'm not sure if you have a website or if anybody ever wanted to get in contact with you. I don't know if you have a number or an email. If anybody wanted to say, hey, Dr. Ballen, I have questions, or hey, I might want to be one of your patients if you have any of that information to share. Or if you have a place where you'd recommend people go that you feel, hey, this is credible. If you want to learn more about what I do, this is where I would go to get my information. And then just anything else you want to share to close this out. Sure.
If anyone has any questions regarding COVID-19 or public health in general, you can reach out to my email. It's bjbmed, M-E-D, @gmail.com. In terms of good resources for what's going on here, I don't have my own website or anything like that, but I will say that the CDC does have some good information on COVID-19. They update pretty regularly, and in terms of, best ways to protect yourself and to protect your family, they do provide very good information with regards to that. So I would recommend going to that website. There's other stuff I recommend. I think they're a little too nuanced, too in the weeds, so to speak. But just for general knowledge information about COVID-19, I think the CDC is very well laid out.
Great, thank you. So yeah, her email, from what I heard, is V as in Venus, and I guess J is in Jupiter, and then B is in Ballen, which is your last name, right?
Funny.
I promise I did not mean to make a joke of that. I was just
joke, my friend.
at gmail.com, right?
Yes.
Okay, so vjb@gmail.com. If you have any questions, she'd be more than happy to see how she could help you or refer you to where you need to go. So thank you, Dr. Ballen, for coming on our show.
Thank you. I don't know if there was any other residual questions that you maybe feel that I need to answer a little more clearly. I'm more than happy to do it right now before you sign off.
No, you did great. Everything I needed is perfect with what I wanted you to let me know and let our viewers know. And then more importantly, they could be able to watch this and check that email too if they ever had any more follow-up questions. But I definitely got all my questions answered.
I will say this as a last thing. If you are concerned, to the general public out there, if you are concerned that you may have been in contact with COVID-19, or if you have any of the variety of symptoms that the infection consists of, which includes fever, cough, runny nose, chills, almost like you have the flu, loss of smell, loss of taste, if you have shortness of breath, difficulty breathing, or weird rashes, please call your doctor to get tested. It is super important. And the moment you are concerned, please isolate yourself, to not just to protect yourself, but also to protect your community and to protect your neighbors.
Great. Thank you, Dr. Ballen. And now, a word from our sponsors.